I don't think that in a democracy, a liberal democracy like India, where media is free. Remember, we get to know of oxygen shortages, babies' deaths in hospitals in remote parts of the country. We get to know them over time. So it is not possible to hide things in India. And frankly, that is the reason I believe that the explanation for what is happening is much simpler than what is being ascribed to, that there is a grand conspiracy to hide numbers. I think the explanation is far simpler. I think the explanation is that we just don't know. We have two basic official sources of doing that. One is, of course, the estimate of deaths in India, which is representative at the national level and at the state level, but not at the district level because it is based on large samples. This is called the sample registration system, the SRS. Unfortunately, the SRS has remained the same over the last 60 years, and we need to improve it. I think first and foremost, that is number one. Number two, because we estimate deaths, it means we still don't account for every death, right? I mean, it's not like we know exactly who, where died. So these are representative at national and state level, not at district, and our districts are very large. Second is the fact that the civil registration system, which we call the CRS, is really based on greater digitization efforts. It is also happening in places where healthcare facility is more. We have more registration of deaths in cities, in states which have better healthcare. So the CRS, if you note over time, which is what most data scientists and a lot of researchers more recently have started using, the CRS does not, in fact, it is not equipped to measure death simply because you are seeing an increased registration with time. So if you look at 2019 data and you compare it with the last 4 years before that, then you will come up with a very erroneous conclusion that there were around 1.3 million excess deaths in 2019, even before COVID. But that is largely on the account of the fact that greater registrations are happening in India. We have reached around 92% registration, huge variations across states. In fact, if you look at level of registration, then in Manipur, we have 21%. That is comparing CRS to the SRS. So how many deaths are registered compared to how many deaths are estimated? It's 21% in Manipur. But in a place like Chandigarh, it is 463%. What does that mean? It tells you that the registration is of people who are coming from all around Chandigarh to Chandigarh for healthcare. There are deaths that are happening in Chandigarh, which are not domiciliary deaths. These are people from around the neighborhood. And it is the same case if you look at Delhi. Delhi has always had more than 250% registrations in the last decade or so. You will see the same thing in Karnataka. You will see this in almost all developed parts of the country, and definitely the big metros, that is likely to be. So if you extrapolate from the CRS to how many excess deaths have happened in India, you're likely going to come up with extremely sensational numbers. The third source, which is now getting used increasingly by researchers, is the one from CMI. They put up the Consumer Pyramid Household Survey. And the problem with that one is that, it is a survey really done to capture or to measure consumption and labor force participation in the country. It is not meant to capture rare events like death. So the entire sampling process of the CPHS is very different from what the SRS is, for instance. I've just given you a snapshot of the three basic data sets, what the problems are. But the underlying issue is that we have a very archaic data architecture. And it is high time. And this particular pandemic has definitely put that problem at the center, in front of each of us who are interested in policy. And I think it's the biggest task for the government now. Unlike rich countries, you see, OECD countries have very robust CRVS systems. So in these countries in Western Europe, you can measure deaths over years and account for excess death and attribute that to COVID. And perhaps that would be the right way to do it, because we haven't really defined what is a COVID death yet. And this is the problem even in developed countries, that what is the cause of death is going to, COVID deaths are still getting defined in different countries. So to be all inclusive and to get a sense of what the loss has been in terms of lives, researchers are doing excess death estimates. And it makes sense for those countries where the CRVS system is good. But in a country like India, where the CRVS system is not, it's not suitable for this kind of analysis, you are likely to come up with extremely sensational, misleading, sometimes scary, but also remember, it could be completely downplaying the problem as well. We don't know what the extent of the problem is. This discussion is getting passionate. I think everyone is interested, and therefore you are seeing the kind of numbers which are being thrown. It's very misleading to come up with these kind of estimates in the middle of a pandemic as well. So I don't think that in a democracy where media is free, remember, we get to know of oxygen shortages, babies' deaths in hospitals in remote parts of the country. We get to know them over time. So it is not possible to hide things in India. And frankly, that is the reason I believe that the explanation for what is happening is much simpler than what is being ascribed to, that there is a grand conspiracy to hide numbers. I think the explanation is far simpler. I think the explanation is that we just don't know. The system doesn't know. The data architecture does not lend itself to a real-time measurement of deaths. And therefore, the large survey becomes absolutely important.